Hi, I'm Margot Freitag from Freitag Health Mastery, and today we're going to be talking about one of the most understated effects of menopause, which is musculoskeletal pain. It's known as the Musculoskeletal Syndrome of Menopause, and unless you've been there and lived it, you won't really get that it can be absolutely crippling. And if you have experienced it, there's a chance you don't know it's related to decreases in estrogen. So with 16 years of experience as a massage therapist, specializing in the assessment and treatment of soft tissue and joint dysfunction and remedial exercise in medical treatment, and countless hours of continuing education in musculoskeletal dysfunction, and as a fitness expert, I'm proud to say that solutions to physical pain are an important aspect of our program, the Body Balance Code, and it adds to our unique approach to providing relief and achieving optimal health and sets us apart from other menopausal and weight loss programs. All right, a meta-analysis highlighted that approximately 71% of perimenopausal women experience musculoskeletal pain, with the risk increasing during the menopausal transition. This is why you're hurting. And I'd like to start by saying you aren't typically achy and sore because you were hard on your body when you were young. On the contrary, the more physically active we are early in life, the stronger our bones are and the more muscles we develop, which pays dividends later on. Tell your kids. Nonetheless, when estrogen levels start to decline, we experience decreases in bone density and muscle mass, and this can lead to muscle injuries and associated pain, as well as osteoporosis and increased fracture risk. A decline in estrogen also causes a reduction in collagen production, which doesn't just mean wrinkles. Collagen is an integral component of many of our tissues, and when it comes to ligaments, collagen makes up 80%. Ligaments connect bone to other bone, which provides stability and support to joints while limiting excessive movement. As collagen levels decrease, the integrity of ligaments is compromised, and we can begin to lose stability in our joints. We see the repercussions of this often in the pelvic girdle, causing misalignment or rotation, and the pain can be debilitating. Muscle loss, bone loss, weaker ligaments, all of these can lead to joint inflammation and other conditions that impair the integrity of joint capsules, often presenting as conditions like frozen shoulder. Joints can become inflamed, and this can lead to stiffness and friction, bursitis, and other pain syndromes as well. All to say, if you're achy and sore, if your back keeps going out, and muscle, joint, and skeletal pain is impacting your quality of life, it's not just in your head. This is real. What's more is that some medications that are offered during this time of life show varied results. There's a suggestion that some of these things can help with pain syndromes, but there's also evidence that it can make it worse. Other medications that are typically being prescribed more during this phase of life can also cause muscle and joint pain. Just a few of these include statins, some antibiotics, bisphosphonates, and some antidepressants. So be aware of any medications that may be adding fuel to the fire. The good news is there is a solution. And unfortunately, the billion-dollar collagen industry isn't it. The collagen you make is the collagen that supports your body. More on that in a moment. But first, here's the beautiful and simple solution to your pain. Number one, anti-inflammatory foods. An alkaline approach to diet will pay dividends. Number two, weight-bearing exercise and strength training. 3, stretch and flexibility. Number 4, remedial exercise for specific conditions. And number 5, realignment of joints using your own muscle energy. Here's why. Vitamin C stimulates collagen production, and so does weight-bearing exercise. Strength training also improves muscle size and strength. It supports your skeleton and increases bone density. Remedial exercise targets specific conditions, and realignment of joints, like your pelvic girdle, will give you relief while you strengthen for additional support. Getting stronger, improving flexibility, and eating whole alkaline foods improves circulation and nourishes cells, decreases inflammation, increases mobility, and improves joint function. There are other considerations like foods you should include and foods to avoid, but this is going to give you a great starting place. So just to wrap this up, more than 35 symptoms are known to be associated with menopause, including hot flashes, brain fog, sleep disturbances, anxiety, and loss of libido. However, more than 70% of women will experience musculoskeletal symptoms, and 25% of women will be disabled by them through the transition from perimenopause to postmenopause. This is often an unrecognized collective of musculoskeletal symptoms, largely influenced by estrogen flux. It includes arthralgia or joint stiffness, loss of muscle mass, loss of bone density, progression of osteoarthritis and fracture, increased tendon and ligament injury, adhesive capsulitis like frozen shoulder, bursitis, and increasing fragility of cartilage. These changes can be permanent, so I encourage you not to just grin and bear it or live on painkillers, because there is a solution. Schedule a body balance code consultation with me or click the link to watch the masterclass. I look forward to hearing from you, and I look forward to helping you out.